Hi everyone, Dr. Remy from Pain Free and Fit. Today we're going to be going over the essential stretches that you need to be doing if you suffer from degenerative disc disease in your neck or cervical spine. Hope you enjoy. So keep in mind that these essential stretching exercises are all based on knowing what your unique posture and mechanical issues are. If you're not keeping your unique posture and mechanical issues in mind while doing these stretches, you're not going to be getting the full effect of pain relief, and you're not going to be helping to restore normal mechanics, which decrease the stress to those degenerative discs. If you've yet to do so, please go to the Posture Size or Pain Free and Fit websites. There's a free body analysis there where you can learn about your unique posture and mechanical tendencies so you can hold those corrections. For instance, if we're stretching and we're doing a simple sideways stretch, if we're not making sure of our shoulder blade posture to have it in correct alignment, and we have a tendency to, say, tip the shoulder blade or to wing it or to downward or abduct rotate it, what's going to happen is as we're doing that stretch, we're not actually correcting the exact pull and correct the fibrosis and the shortening of those muscles in the exact way that we need to restore a balanced state to our muscles and thus the stress on our neck. So if you don't hold your posture correctly while doing these stretches, you're only going to be strengthening your dysfunction, driving more stress into the neck. So keep in mind your corrections. With that being said, remember that we're going to hold stretch positions from between 15 seconds up to 60 seconds, sometimes as long as 2 minutes. You only want to stretch as far as is comfortable in all of these stretches, and you want to make sure that you're holding a mild stretch, because if you feel a major stretch while you're stretching, the body won't relax. The muscle spindles in the muscle are going to be stimulated and the muscle is going to tighten to try to protect. So you only want to go until you feel a mild stretch. So let's go through these series of stretches so you can try them to help. Number one, we're going to stretch the short extensor muscles at the back of our skull where they attach to our neck, because a lot of times with cervical degenerative disc disease, we have a problem from forward head posture where those muscles shorten. So the exercise is simply to pull the face towards the back of the head and to tuck the chin down and under the jaw. And that opens up the back of the skull and the first vertebra. You see that motion? So there's the problem, and the stretch is simply pulling the face back, chin under, until you feel a little pull or stretch at the back of the skull or the upper neck. Now again, if we have a tendency to laterally flex or tilt our heads to one side or rotate to one side, if we're not holding that correction based on our unique posture and abnormalities and mechanical abnormalities, then when we're doing the stretch, we're not getting the full effect, and we're leaving those muscles tight in that particular way, which then contributes to your pain. So always make sure you're keeping in mind, what corrections do I need as an individual based on my posture and movement tendencies. The next one we're going to do is for the front of the chest muscles, which have a tendency to move forward, and that contributes to shoulder blade tightness and pulling of several muscles that run from our shoulder blade into our neck. This one is pretty simple. We're just going to put our hands behind our back, and we're going to pinch our shoulder blades together. Again, if you have one side that protracts or rounds more than another, that's the side that you need to pull back. Again, specificity is key. We don't want to strengthen dysfunction. We can also use a upper shoulder and chest stretch by bringing our arm up, and we're going to rotate it backwards, which stretches the tight internal rotators of the shoulder, and moving it back and up. And you're going to feel that stretch in here. Again, in all these stretches, we're only going to the point of feeling a mild pull. We continue that with a few basic neck range of motion stretches. A sideways stretch where we're tilting the ear to the shoulder. Avoid with these the tendency to move the head forward. We want to keep the ear on top of the shoulder as we stretch. To both sides, you're going to be spending more time on the side that's tighter. So if your natural tendency is to lean your head to the left or to have a high shoulder on that side, we want to spend more time stretching the opposite way, holding that shoulder blade and head in correction. If we have a tendency to rotate to one side during the stretch, we want to make sure we're rotating the opposite way to get the fullest effect and target specifically our unique soft tissues that have tightened and hold our bodies in that distortion pattern, because that's what we're trying to loosen to decrease the mechanical stress on our degenerative discs in our neck. We can follow that up with a rotation stretch where we're looking to one side. You can do that to both sides and include the upper thoracic or mid-back with that by turning your shoulder blades with the head. The neck and the upper back work together as an integrated unit with stretching, so we should stretch those with our stretches using both body areas as well. Our belly button remains facing forward with that. We can also target our trapezius muscle by leaning our ear towards the front of our shoulder as the opposite shoulder stays down. Again, I want to make sure I'm having a good shoulder blade neutral position, avoiding any tipping, rounding, abducted or downward rotated tendencies. I want to make sure as I'm doing this, if I naturally turn my face to the right in my normal posture from an asymmetrical daily activity, I want to decrease that turn to that side as I lean forward. We want to do that to both sides, as is all of these stretches. And we'll continue with a chin to the front of the shoulder stretch with the opposite shoulder down. That targets the levator scapular muscle. We can also include an SCM stretch, which is a very tight muscle that goes from the back of your skull down to your collarbone. That's often tight from having forward head posture, rounded shoulder posture. To stretch the right side, we're going to look to the right, up and back, and lean a little bit to the opposite side, to the left, as I tilt my head back. I'm going to feel a little pull in there. You can change the amount of turn, tilt, and backwards until you feel just the right amount of stretch, which again is a mild amount. We can also include an extension stretch, which is very important. The lower neck has a tendency to become flexed forward, which puts a lot of stress on the cervical spine, as well as the upper back rounds. So this stretch is simply taking your chest and lifting it forward and up. And as you look back, you're not trying to tilt your head back, but you're trying to move backwards from the bottom of the neck. Do you see that stretch there? That's the mistake. I don't want to move my head and my neck. I want to move my neck and my mid-back back and up, and I'm going to hold that. So again, all of these stretches you're holding from 15 seconds to at least a minute, mild degree of stretch until you feel the tension release, and then you can go a second and a third stretch. Very deep tightness in the joints is helped with chiropractic manipulation. That's the most specific type of manipulation out there. You can also engage in soft tissue work, such as active release technique, pneumoreceptor tonus technique, myofascial release technique, massage, manual therapy to loosen up deep scarring and fibrosis in muscles and soft tissues. That will help you get a better range of motion. Sometimes when you're doing these stretches, you'll become limited because you either have pain because a joint is being pinched, a disc fiber is being torqued too much, the soft tissues don't want to give. So that's why we include other types of therapies such as manipulation and deep soft tissue work to assist our ranges of motion. If you enjoy this exercise of stretches, I invite you to subscribe to our channel. We have a lot more stretching exercises as well as the very important strengthening conditioning exercises which help to hold your mechanics and posture in a neutral position so these muscles and soft tissues don't keep tightening. People that have to stretch all the time, there's usually a reason for that. They're not including strengthening and conditioning exercises that bring the body back into balance, that helps you avoid the need to stretch so much. If you'd like to help me share this with other people, please give me a thumbs up below, leave your comments. I'll do my best to get back to you. I hope this stretching series of essential neck stretches helps with your degenerative disc disease of your cervical spine neck region.